In a few hours, National Cabinet will reconvene as it seeks to reboot the country's sluggish vaccine rollout. Let's go live now to our political reporter, Jonathan Lea, who's in Canberra. Jonathan, the government is bringing in additional experience.
Yeah, they are in many ways. Laura, good morning to you. They're turning to the military, especially this new Navy Commodore Eric Young we're hearing about. It was announced almost covertly on Friday. There wasn't a great deal of fanfare. We learnt a little bit more over the weekend. He's going to be assisting with logistics and supply. We know how far the government is behind now in its vaccine rollout. We're approaching 1.5 million jabs. The government hoped we'd be at 4 million by March. So there's talk of these mass vaccination hubs now. Seems there's support from New South Wales, Victoria, Tasmania, South Australia. But the Prime Minister has made clear over the weekend in his Sunday press conference, at least, that he believes GPs and GP clinics should be the first point or the preferred choice when it comes to delivering the jab.
In the back part of the year, particularly in Q4, if we have sufficient stocks of those vaccines in Q4 with the Novavax vaccine, then that will lend itself to other vaccination models, particularly mass vaccination. Now, I know some states are very interested in supporting larger vaccination programs now for people aged 50 to 70, and we are very open to discussing that with the states.
Now, part of the idea around this seems to be the notion that they can mass vaccinate those aged over 50 with the AstraZeneca jab, which we have the sovereign capability here in a large number of supplies, and then free the way for those much younger when we get this Pfizer vaccine coming to Australia, hopefully in the fourth quarter of the year. But Michelle Rowland from the Labor Party makes the point that mass hubs are no good unless you've got the vaccinations needed.
Appears, just taking, for example, overseas examples, that appears to be the way in which that sort of critical mass is being achieved. But you have to take a step back from that, and that is the supply of the vaccines itself. So before you even start contemplating where you're going to have these centres, you need to have the supply.
And Jonathan Lea, home quarantining on today's agenda, but I suspect we should not hold our breath on this one.
No, I'm told, Laura, it's not officially on the agenda, but it might very well come up in conversation. Scott Morrison floating the idea. There's concern from the states, Western Australia, no great surprise there. Michael McCormack, the Deputy Prime Minister, asked on Sky this morning if the idea is already dead upon arrival. Here's his response.
No, it's not, and preliminary discussions are taking place. I know Mark McGowan he's floated the idea. The Health Minister in Victoria, Mark Foley, he's talked about it too. They're only preliminary discussions, and we need to be able to talk about it. That's what National Cabinet is for. It's worked to that end very well so far. We've made those discussions. That's why we've kept Australians safe, and that's why, as a government, as a federal government, you know, we've cooperated and worked collaboratively with our state public health authorities, with the states, with the premiers, with the chief ministers, and that's what we'll continue to do.
If we're in a situation though where there's higher levels of vaccination, lower rates of disease, well, I think we can adjust our settings a little, and that's what home quarantine would allow us to do. But it's going to have to be, obviously, risk-based approach and commensurate with the, it needs to be proportionate as well with.
Yeah, Laura, with the federal government making very clear it's undertaking no mass reform this year and its priority being the vaccine rollout, there is an enormous amount of pressure as it now turns to the states to assist with the vaccine rollout.
Indeed, Jonathan Lea, keep us posted. That meeting a little later on today.